So welcome guys to another episode. Today we've got Dr. Daps, who you've seen before, and we've got Emily, who's going to be applying for dentistry. So going to enjoy it, especially if you're a student studying a science degree and looking to apply to dentistry and possibly the graduate entry programs as well. So welcome, Dr. Daps.
Hi guys.
And welcome, Emily.
Hello.
So Emily, just tell us a little bit about the stage that you're at and what your ambitions are before we get into it.
So I've just finished my first year of biomedical science at the University of Sheffield. So I will be applying to graduate entry dentistry going into the next academic year. So not this October, but next October.
Okay. And what universities are you looking to apply to? Have you had previous experience of applying dentistry?
Yeah, I applied when I was in sixth form. So I applied to Manchester and Leeds, where I got interviews, and then wasn't successful after the interview. And then I applied at Queen Mary London and Liverpool, where I didn't get an interview.
Yeah.
But for graduate entry, I'm looking at UCLan. I think they do it at Aberdeen and then King's College London. So.
Are you going to consider applying for a 5-year as well?
Potentially, yeah. If it gives me a better chance of getting in, then yeah.
Yeah, I just say don't rule anything out.
Mm-hmm.
So are you able to expand on that, Dr. Daps?
I just think if you could have got the 4-year opportunity, and then also the 5-year opportunity, it's just a year. I know some people think because they're graduates, it might be a bit of a longer time. It's just a year. A year goes by so quickly. So I wouldn't eliminate just the 5-year and just trying to select 5-year opportunities. So maybe if you can apply to a mixture of both.
Yeah. Are the
at the
student finance things different? Is that?
Sorry, carry on.
I thought the difference between graduate entry and normal undergraduate was you didn't get student finance or something like that. So maybe that's what I was.
Oh, that could be an issue as well. I think there's a difference in the finance side of it as well. So it just depends on each person's different situation.
Yeah.
So for the 5-year, definitely you'd have to be able to finance a larger portion of the course each year. You do get some support from student finance and NHS England once you get into the later years, but initially you have a bigger amount to fund the course.
Okay.
What I was going to say though is a potential benefit of applying to the 5-year, even if you're not going to go for it, is the fact that you can get experience of interview experience at that uni, and it keeps options open. Okay, so I know that you're not going to be using this personal statement for your application process because you've still got about 12 months until you put it through, but it gives us an ability to see what you've been up to, what you've been doing. Would you say you've changed it much since you initially applied?
Yeah, this is a completely new one because the last one, it was kind of weird looking back at it actually. So I just wrote a new one.
Yeah, because obviously I had the same experience. I think I applied. Well, I know I applied twice. And when you do it a second time round, you just see things that you didn't like with your first one. You try and take all that stuff out and put it into, try and edit it and make sure your second one's a bit better than the first.
Yeah, definitely.
All right. So when I was looking at the personal statement, the one thing that did stick out to me was the fact that you haven't yet started putting in information about your current degree.
Okay.
So at the moment, what have you been doing within your current degree?
I've been doing sort of physiology and pharmacology and things sort of like that, and then we've done neuroscience as well. So.
And
I did have a little bit about that in, but I think the word count was too high and I took it out. So.
Fine.
I think it would make up a large component of your personal statement because that's going to have been 2 years of your education. And the admissions tutors are going to want to see what's been the benefit of you spending that 2 years doing that degree, because you won't have finished third year by the time you apply, but you'd have done 2 years. So they'll be interested to know, how has the course you've just done actually helped you and developed you as a person? So it's something to think about.
Especially if you can link it to something like dentistry related as well. So obviously the anatomy and the physiology, the neuroscience are things that you're going to also use in your dentistry degree. So I think it would be beneficial for you to also include that.
Yeah. I remember when I did mine, because I applied for graduate entry, I did mention about action potentials and how the local anesthetics works to affect action potentials and you know, cause anesthesia. So I was able to mention that and relate it to what I observed with the dentist actually anesthetizing patients. So there'll be something that you've done that you can relate to dentistry. And I think even in the 5-year courses, Dr. Daps, correct me, but the first year is heavily focused on anatomy, the science, cells, physiology, that sort of thing.
Yeah.
Yeah. What were your thoughts, Dr. Daps?
No, I thought it was a very good personal statement. What was I looking at? Because also the thing that I liked as well, because when I applied, I'd also worked in sales, so I worked in Next. So, and also I saw that you worked in M&S. So I think that's just something different, that they can see that you've got a good basis of dealing with patients, because dentistry is a degree whereby you're dealing with the public day in, day out. So having that is something that will put you different to other people. So I did like that about your personal statement, not just because you work somewhere, but just because you worked in a place that you're going to be dealing with patients or the public day in, day out. I did like that part. And the fact that you've done a lot of Zoom, I think I read somewhere that you did Zoom, what do we call it? Zoom work experience?
Yeah, actually that was with Arnold, yeah.
Yeah, I think I read that you did some work experience via Zoom, virtually. So I think obviously in the times that we're in, there's not going to be the opportunity for you to physically go into the dental setting. So the fact that did you get that yourself, or did they offer that to you?
I found that myself, actually, yeah.
Exactly. So you've shown a little bit of initiative to be able to use the best of the situation, whereby they can still show you what's going on in a day-to-day dental scenario, even if it isn't in the physical, if it is virtual, because I don't think at this time many practices are going to be allowing students to come in with everything that's going on. So you've still been able to do well in that aspect. That's what I got from it.
Yeah, I get the sense that because you've done so much, that it came to a point where you're almost listing what you've done.
Yeah, a bit.
So I think that can be a bit of a trap that applicants can fall into, because you want to show that you've been proactive, you've been doing all these things. But where the personal statement starts to get unique and different is when you start to reflect. So for example, when you're talking about, you know, working for M&S and how that helps you with handling complaints, you know, talk a little bit more about that. Talk about a complaint, you know, that you handled or that you prevented from happening at M&S, because that's something that we as dentists need to be on top of. We need to be able to handle complaints that come, and we need to be able to prevent complaints from happening. So that would be perfect to show your suitability as a future dentist. You talked about, you know, teaching kids to swim. You know, I'm still learning how to swim. You know, that's amazing. So even that, you know, teaching kids how to swim means that you'll be able to teach children preventative dentistry. You know, I could completely see that parallel. But if you start to reflect now what you do with what you know dentists do and experience, then your personal statements really starts to stand out.
Okay.
I think that any point that you do make, try and link it back to how it's going to be helped in dentistry, or how you're going to use that skill in dentistry. So then it becomes less of a list and more of a point that you've made, and you know that you're linking it back to how it's going to help you in that degree in the future.
Okay.
Another thing that I was looking at was the work experience that you did manage to get. So you managed to have a look at a general NHS practice, as well as an orthodontic practice, which is great. It's amazing. What I'd say is within this next 12 months, as the lockdown eases and things start to get back to some normality, consider trying to maybe get some experience at a dental lab,
Okay.
maybe at a community dental practice, even a
Mhm.
hospital. Try and just get a more diverse range of work experiences. Obviously, we don't know how things are going to go with the lockdown, but as things start to open up, you may get an opportunity to do something like that.
Okay, actually, that was one of my questions that I had for you, because I'll be doing it this time next year, so maybe things will be different. Yeah.
Yeah.
Okay.
So definitely look to be reflecting more, linking back to dentistry and your suitability, and having that component of your current degree, because with the graduate entry courses, everyone is going to be leaning heavily into how they benefit from their current course. Any other general advice that you'd give, Dr. Daps?
I'd just say, just don't lie. I think that's the biggest one that I think a lot of people always say, don't lie. You never know what type of interview station they can give you, where they might just ask you something on your personal statement that you might have tweaked the truth about. And if they catch you out on your interview, that's just another reason for them to say no to you. So I'd say anything that you do put in your personal statement, I would just say I'd make sure it's wholly truthful, and you can back it up. So even if you're saying you like read some magazines, or you've written in your personal statement you read the latest article, and then in your interview, the interviewer asks you, what did you think on this article in the latest issue of the magazine, and you don't know and you're just stuck, it's not going to look good. So I just say make sure you just tell the truth. Your personality will shine through and you don't need to lie in a personal statement. That's probably the biggest thing I'd say.
Yeah. And because you've committed to applying to graduate entry courses, there are only three, really: Aberdeen, UCLan, and King's. So you've got no excuse for not going on their websites and reading everything about their dental course, even the boring documents. I would say really dig into that, because what you're going to get is little comments and statements that they'll say, which you can pick up on and put into your personal statement. And better yet, when you have your interview, you'll be able to show that you've really researched their university. So for example, if you went onto the UCLan dental website and you start looking at the documents that they've put there, I did this a few months ago, you'll start to find that they talk about things like the DECs, the dental education centers. They talk about the ETPs, the enhanced training practices. This is about, they talk about these in terms of the progression that students have from year 1 to year 4. So if you start now picking up on the language that they use and incorporating that into your personal statement and into your interviews, you start to stand out as somebody that's seriously considered their course and their university for dentistry. So between now and your application process, I would spend time researching each of the universities, going on their websites. I don't think many students actually read all that the dental schools put out, and I think that's a key missing trick that people are missing out on.
No, I'd agree. I think the website is them showing what they like and the stuff that they look for in students. So I think it's a good place to start when looking at universities and making all of these decisions.
Mm-hmm.
And I'd also say speak with students or dentists that have been to those dental schools. So for example, Dr. Daps went to Liverpool. He'd be able to tell you more about what Liverpool like, the flavor of Liverpool Dental School. I've been to UCLan, so I'd be able to talk about, the way UCLan is structured. Find somebody that's been to King's, specifically somebody that's gone on to the graduate program, and then you'll be able to pick up on more things. So I'd say definitely talk to students will be best really, who are currently in the dental school between now and next year. And it just means that you're immersing yourself in the dental terminology and the things you need to be considering to make yourself stand out and the application much stronger. Yeah.
Right.
Any questions?
I don't think so. As I said, my question for you was about the work experience and the sort of guidance on it, as to, because I know that dentists have to wear, you know, the full PPE and things like that, and it wouldn't really be, you know, okay for me to, you know, be in there. So yeah, that was it really.
Any thoughts, Daps?
I just think I think now maybe not physically going in. I think as restrictions ease, I think you might be more likely to go be able to go in and get in there. If they're going to offer Zoom, I'd say take the most advantage of that as possible. But as Arnold was saying, labs, I don't think I've ever heard of anyone going to a lab. So if I read a personal statement and someone had been to a lab, I think it would stand out for me quite a lot. It's just showing that you've got that range and diversity of going to different places within the dental field, because it just doesn't stop with the dentist. There is the technicians going to the lab. They make our crowns, our dentures. So being able to show that you know the whole process of the stages within dentistry, it will make you and your application a lot more rounded, is what I would say.
Mm-hmm. Okay.
Another thing that you can start to do is you can start to connect with the local dentists or dental care professionals, even if it's hygienists, therapists, or even dental nurses. Start to connect with them online within your area. And then once you do that, you start talking to them regularly, just finding out about their job over the next few months. When lockdown eases, you're not starting from a cold place. You've already warmed up. You've already built a relationship. They're more open to then having you on because they know you now. You know, you've been keeping in touch over the best part of 6 or 7 months. So it'll be more likely that you'll get the opportunity with them to shadow and find out more about the dental field. I was actually thinking, you know, how would I try and get myself work experience in the dental field if I was to start again? And I was thinking a lot of this might not be for you, but it might be for somebody else who can relate. I was thinking one thing that dentistry doesn't do that much is social media.
Yeah.
So a lot of dental practices actually don't have a social media page. I was thinking, imagine if somebody who's actually quite good at using social media offered to start a page for a dental practice, and then they offered to post content for that dental practice. Obviously, they'd have to be liaising with the principal, the owner of the practice. And through that, you get to have this relationship with the dental practice, with the dentist, with dental care professionals, and you're finding out, you know, how to present a dental practice to the public. You're learning skills that you otherwise wouldn't get so freely, that you could then talk about within a personal statement and within an interview. And you'd have helped a local dental practice with their online presence. It might not be for everyone, but it's thinking a bit creatively about ways that you can really stand out.
Mm-hmm. Yeah, that's a good idea. Yeah.
Any last questions before we start to round it up?
Maybe just if you have any sort of interview tips for the, you know, for the MMIs, because I did find them quite hard.
So tell us a little bit about how your MMIs went when you applied. What did you feel your strengths were? What did you feel your weaknesses were?
I thought I was good at the role play, like with the actors. For example, in my leads one, there was an older gentleman who had dementia, and he was lost or something, and I had to help him. I think I did all right on that one. In the lead one, I had to prepare a presentation before, which I found quite difficult. So in a Manchester one, I think I did all right at the talking about fluoridation of water and things like that, and like medical ethics.
Yeah.
So yeah.
And how did you practice and prepare for those interviews?
I did them for my parents, which is especially the presentation bit, I just talked through it like over and over.
Yeah. So before I let Dr. Daps tell us about how he would suggest preparing, the one thing is definitely try and prepare with people that you're not so familiar with. So as a starting point, family is good, but you need to prepare with people that you don't have that relationship with, because then you're not putting yourself in the, in a similar environment and atmosphere, because the pressure is different when you don't know the people that are questioning you. It's a bigger pressure. Yeah, Dr. Daps.
Yeah, so I'd agree. In relation to what Dr. Arnold just said, I'd say try and practice with friends that I wouldn't say are horrible, but are blunt, and will tell you how it is. Like, essentially, if you're doing awful, they will literally tell you. There's no point being around yes men that saying, "Oh, that's great," and then you come to your interview. The people that are interviewing you are not going to be yes men. They're literally going to be harsh. So if you can find friends or people that you don't know that will literally going to tell you the truth or how it is, that will help. I would also say when it comes to it, forget each station. So I know MMI is like multi-mini interviews, whereby you just need to forget whatever happened in the last station. If the last station went awfully, you need to forget about it and remember that the person in the new station won't know anything about what happened in the last station. So if you're harboring emotions from the last station, it will come out naturally in your new station. So if you get, I know in Liverpool when they did MMIs, there's a little bit, actually no, there's not. I was going to say there's a break in between each station, but there's actually not. If you can just forget about what happened in the last station, forget about it and move on to the next, that's probably the best piece of information I would give you in regards to MMIs. Yeah.
And there are always going to be questions which we all know are going to come up. Why do you want to study dentistry or become a dentist? It's going to come up in some way, shape, or form. So I'm not saying to memorize an answer, but I'm saying you should know your reason why.
Yeah.
And be able to articulate that in the context of how that question is asked to you. So be confident in how you would approach that sort of question. There's likely to be a question on the dental school, why that dental school, or why you want to move to that city, or you'll be sat in front of a dental student, so think about what you would really want to ask them about their course, about the city and societies, that sort of thing. The more that you can be confident in those sorts of questions being asked, it means that you can dedicate the rest of your energies to the questions where it could be anything.
Right.
Yeah.
Okay.
You can minimize or you can prepare for a couple of questions you know are going to come. And as Dr. Arnold said, don't prepare them, because you can tell when someone's over prepared an answer, but just have a rough idea of what you're going to say. And then the ones that you know, or they're just going to be obscure, you didn't know anything about, you can then think or use a little bit more of brain energy on those questions on the day and relax. That's another thing. Yeah. As much as you can.
Yeah.
But the great thing is there's about 12 months. So you're in a good place to be ready when it comes down to it. And do keep in touch. You can message as you have before, and we'll be able to help you at each stage as you go along.
Great, thank you.
No worries.
Right. Well, guys, make sure to tune in to the other videos, to subscribe, turn your notifications, and we'll be trying to do more of these sessions where we can help people as they apply to dentistry.